everyone, it's Dr. David Clark here. I want to answer this question. Why does my doctor say that my thyroid tests are normal, but I have all of these low thyroid symptoms? Well, I'm going to answer that question for you. So what are these low thyroid symptoms? Well, just for some of you that may not know, it's things like depression, hair loss on the head, the out of the eyebrows, hair loss in other parts of the body, fatigue, having to sleep 10, 12 hours, feeling like you don't get enough sleep, intolerance to cold, constipation, dry skin, infertility, high cholesterol. I mean, those are all very classical low thyroid symptoms. And I see a lot of people that have low thyroid symptoms, but their lab tests that they've had done, their doctor says, well, your lab tests are normal. Why is that? Well, there's two reasons. The first thing is you have to kind of understand about how lab ranges are established. Now, lab ranges on most markers that you see on a blood test, there's not this committee sitting around like at Harvard or the Mayo Clinic saying, well, we think it should be 5.2. That's not what happens. Really what happens in most of these labs for most of these markers, it's just a bell curve analysis. They take all the people that are being tested at that particular location, and they throw out the highs and they throw out the lows, and they basically say, look, here's the normal range. Well, I think you can probably see the flaw with that, which is, first of all, who gets their blood drawn? Really healthy people or people who are sick? Sick people. So over time, the range gets wider and wider, so you have to be really terribly sick on your labs in order for it to get picked up. That's the first reason why your doctor says your labs are normal, because the ranges that they're using are just too forgiving. I'll give you an example. Most labs or most doctors will look at a lab and they'll say, hey, the TSH is in the normal range. Well, TSH can vary widely from like 0.4 to like 5. That is an incredible range. I mean, the range we use is 1.8 to 3. It's a narrower range. So depending on what lab range is the lab that you're using and the doctor is looking at, they may say, yeah, your lab tests are normal. So that's the first reason. Now, the second reason why your doctor says your lab tests are normal is they probably aren't running enough of the full panel. Here's what I mean. Typically, most doctors, your GPs, even a lot of endocrinologists, they will typically run a TSH and a total T4. And that's it. And I got to tell you, that is not sufficient enough to pick up a bunch of different problems you can have with your thyroid. Now, there are about 24 different ways that your thyroid hormones can go wrong. The most common is Hashimoto's, which is an autoimmune condition. Guess what? If all you run is a TSH and a T4, you're not going to tell if they got Hashimoto's. Period. That's why so many thousands of women are walking around with Hashimoto's thinking there's something wrong with their head because the doctor said their tests are normal, but the doctor didn't run enough tests. I mean, here's what you really should run, in my opinion. Find a doctor who will run this. A TSH, a total T4, a total T3, a T3 uptake, a reverse T3, free T3 and free T4, and TPO antibodies and TGB antibodies. What is that? That's 9 different markers. If your doctor's only running TSH and T4, that's one of the reasons why he thinks your tests are normal. Now, so ranges are a problem, and not enough tests are a problem. And what I like to do is I like to take a more functional approach, and that's probably where you're best served, is finding someone who takes a functional approach. Someone who says, look, I know what the lab range is, but a narrower range, that's probably more of a reflection of actual healthy people. So check this out. If your TSH was 4.5, I got to tell you, I think that's too high. So if your doctor only did TSH and T4 and the TSH was 4.5, I mean, that tells you something is going on. So you really need to find a doctor who will run enough of the correct panels and know how to interpret them, by the way, as well as not just be, handcuffed by what the lab range is. They got to put on the thinking cap. And that brings up a third problem, which is one of the reasons your doctor may be telling you your tests are normal, is that they're just not thinking. And that doesn't mean they're stupid, they're just not thinking. A lot of doctors that you've seen are in this, HMO insurance model, and they only got 10 minutes to talk to you. I can't tell you how many times I see people come into my office and they say, the last 2 doctors I went to, they didn't even look at me. They literally did not look at me. They certainly didn't touch them. And that's that's the third problem. So the first problem is the lab ranges are too wide. Second problem is they probably didn't run enough tests. And the third problem is you may have seen a doctor who was too pressed for time to take the time to actually listen to what you were telling him. And the fourth problem is to think and read. Most doctors you see now, I'm just going to tell you what I come up in, they don't read. They stopped reading when they got their medical degree or their DC degree or whatever degree they got. They're not really staying current because they just don't have the time to do it. And so those are the 4 big reasons. So I would try to find someone who is not being caught up in those four problems.